The pancreas is an organ that most people rarely think about, yet it plays a crucial role in both digestion and blood sugar control. It produces enzymes that help break down food and hormones, such as insulin, that regulate glucose levels. But what happens when this organ becomes inflamed and begins damaging itself? This condition is called pancreatitis, and it can range from a temporary illness to a life-threatening medical emergency. So what exactly is pancreatitis? Pancreatitis is a condition in which the pancreas becomes inflamed. Normally, the pancreas produces digestive enzymes that remain inactive until they reach the small intestine. Once there, they help digest fats, proteins, and carbohydrates. In pancreatitis, these enzymes become activated too early, while still inside the pancreas. Instead of digesting food, they begin damaging the pancreas itself. This triggers inflammation, swelling, and injury to the surrounding tissue. There are two main forms of pancreatitis. Acute pancreatitis develops suddenly and may last for a few days. In many cases, it improves with treatment. Chronic pancreatitis develops over time and causes long-term damage to the pancreas, which can affect digestion and hormone production. The two most common causes of pancreatitis are gallstones and heavy alcohol consumption. Gallstones can block the pancreatic duct, preventing digestive enzymes from leaving the pancreas. Excessive alcohol can damage pancreatic cells and increase the risk of inflammation. Other causes include certain medications, infections, high triglyceride levels, genetic conditions, and abdominal injuries. The symptoms of pancreatitis can be severe. Common symptoms include intense abdominal pain, nausea, vomiting, fever, bloating, and pain that may spread to the back. In severe cases, pancreatitis can affect other organs and become life-threatening. If chronic pancreatitis develops, the pancreas may gradually lose its ability to produce digestive enzymes and insulin. This can lead to malnutrition, weight loss, digestive problems, and diabetes. The understanding of pancreatitis has improved as scientists studied digestive enzymes, inflammation, and pancreatic function. This research has helped doctors better understand how and why the pancreas becomes damaged. Treatment depends on the cause and severity of the condition. Acute pancreatitis often requires hospital care, intravenous fluids, pain management, and treatment of the underlying cause. Chronic pancreatitis may require long-term dietary changes, enzyme replacement therapy, and management of complications such as diabetes. Today, artificial intelligence is helping doctors diagnose and monitor pancreatitis more effectively. AI systems can analyze CT scans, MRI images, ultrasound studies, laboratory results, and patient records to identify inflammation, detect complications, and assess the severity of the disease. Researchers are also using AI to predict which patients are at higher risk of severe pancreatitis, allowing doctors to intervene earlier and improve outcomes. Pancreatitis is a condition that occurs when digestive enzymes begin damaging the pancreas itself. Understanding how it develops highlights the importance of early diagnosis, proper treatment, and protecting the health of an organ that plays a vital role in both digestion and metabolism. But the pancreas doesn't only help digest food, it also controls blood sugar. In our next video, we'll explore diabetes explained and discover what happens when the body can no longer regulate glucose properly.